So Botox is essentially an anti-wrinkle injection that's used to target certain muscles of the face to help with social expressions, but also primarily to just relax any lines and wrinkles.
Yeah, and it also has lots of other medical benefits. So it's going to help with people that have sort of excessive jaw pain associated with grinding, with migraines, and also excessive sweating. So we can inject Botox under the armpits.
The most popular area of treatment with Botox tends to be the upper face, really. So it's your frown muscles, your forehead, and then the smile muscle, also known as your crow's feet.
Yeah, it can also be really useful for the lower face. So things like pebble chin and also the gummy smile.
Yeah, and interestingly also a lot of people love having it around the neck, so it just gives people a very nice subtle lift.
Yeah, and also things like slimming out the face, so having masseter Botox can really help to sort of streamline the facial structure.
Yeah, and interestingly I find probably one of the most beneficial treatments also tends to be the skin quality. So Botox is very good at reducing your skin pore sizes, which tends to help with acne and tends to give people a very lovely glow overall.
Yeah, and lastly, I think the medical uses, such as for people that have hyperhidrosis, which is excessive sweating, it can be a real game changer for them.
So who's it good for? So Botox is generally a very safe treatment for most people. There's a few medical questionnaires that we'll be going through with you when you come for your consultation. So primarily to make sure that you're not pregnant or breastfeeding, and certain medical problems such as neuromuscular disorders.
I think for us, we always say to our patients that it's best to try and get in there early and view Botox as sort of like a preventative treatment rather than like a curative one. So it's about sort of targeting that area before those deep lines form.
Okay, so what to expect? So during the consultation, we'll be going through the medical questionnaire. We'll go through the consent form so you understand the risks and benefits of the treatment itself. And afterwards, we carry out some medical photography primarily for legal purposes. At this point, we'll clean the area out. We don't normally need numbing cream for Botox as we use very tiny needles, so it tends to be quite comfortable overall for patients. And actually the actual treatment time probably only takes about 5 to 10 minutes at most. And we generally tend to find it lasts a really good time for people, right?
Yeah, I think as you were saying about the small needles that we use, so we actually use something called a microneedle, and patients love this. People often come to us and say, wow, that was the most painless Botox we've ever had. And it's definitely because of that microneedle, I would say. I guess the important thing to mention is there isn't really any downtime after you have Botox.
That's right, and what we find is people are able to go back to work or carry on with the normal tasks pretty much immediately. There's a few specific advices that we go through, so a few simple things like keeping the area clean for the first 4 hours, and then for the first 24 hours we try to avoid heat, so things like saunas, intense exercise or sunbathing. And all this is generally emailed out to our patients so that it's a nice reference point.